We don't want to overpromise and then underdeliver.
Right.
That is the cardinal sin of technology. DMEs are going to be run by agentic AI, and that's when you have like a completely new negotiating dynamic.
Morgan, welcome to the Co-Conspirator Track. It's great to have you part of the club,
great
man.
to be here with you.
Really, you have an interesting background. You came from life sciences, biotech. So can you just give us a 30-second overview of you and your background, and then also tell us about Neru Health?
Yeah, so it's been very interesting. I feel like healthcare has touched my life ever since the beginning. I grew up with two disabled siblings.
Okay.
Both my parents are physicians, immigrant physicians. And so I remember when I was a kid, I would look through my parents' New England Journal of Medicine. I had no idea what anything meant, but I was fascinated by the pictures.
Right.
And then growing up, I had an affinity for biology, and it's just like fascinating how our bodies work and how all of really biology works. I mean, these tiny little cell machines that can now be engineered.
Right.
And so when I went to undergrad, I decided to study biology, and I was doing stem cell research, and I was like, I'm either going to become a scientist or a physician.
Yeah.
Decided I wasn't patient enough for science.
Sure.
It takes a lot of patience, a lot of extreme attention to detail, and I don't think I had the singular drive to be a physician.
Yeah.
Like, it wasn't the only career I could see myself doing. And ended up discovering entrepreneurship through this business fraternity that I was a part of. It was like, okay, let me go explore what like building a company is like. And then worked briefly in venture capital, and I remember a mentor was like, hey, if you want to eventually build a company yourself, go and join one. Go and join a startup and learn how they build it. And so I worked for two life science startups, one doing antibody therapeutics, where we looked for rare native human antibodies and healthy donor blood and turned those into drugs for other people. While through all of that, I was going through my own health journey, which was struggling with insomnia and sleep apnea. So I got diagnosed with sleep apnea shortly after undergrad, did not treat it well, and ended up developing insomnia as a result. And so I was like struggling with my own health challenges while going through this like entrepreneurial journey.
Yeah. And
then in graduate school, met my co-founder, who was a diabetes patient, and we came together and we're like, you know what, let's kind of reframe what we're doing in health.
Right.
And fortunately, like generative AI exploded when we graduated. And so that was a perfect opportunity to really think about how we could combine all these data signals that we're getting from devices with what's the next generation of interacting with the patient.
Yeah.
That's how we ended up with Neru.
Wow.
Yeah.
That's awesome. Well, thank you for that background. And I didn't know that about disabled siblings. My older sister was disabled as well. She was born quadriplegic, and she passed away a few years ago.
I'm sorry to hear that.
It's all right. Yeah. I know she's with the Lord now and healed, and so that gives me peace. But yeah, so I share that with you for sure, that empathy, and so and that's something you don't understand unless you've lived it or lived with it, right? So, but they're very special. It's a very special relationship. So
I think a lot of people here at this conference, and in healthcare, they have their own stories. Of what brought them in.
Absolutely, for sure. Well, so since you're coming outside of this kind of traditional HME world, so where do you think is the biggest gap right now with AI? Do you think that, are we on it? Are we doing good? Or is there a gap we need to fill here? Are we behind?
Honestly, I've been impressed with how fast this industry has been adopting AI, and I think it's because of the pressures on the industry, from reimbursement cuts constantly, audits, very complicated operations and complicated patients with complex conditions and complex therapy. So all the complexities make it perfect for AI to really help innovate. And where I think there has been a gap that we are filling was that there's a first wave of digital and AI solutions that really help solve, like, let's get the right documentation, let's get the right prescription, let's get the right order. And then once that has been, and it's still in a process of being solved, then I think now DMEs are focused on like, well, let's manage the patient care more efficiently and at scale. And so that's really where we come in, is like once you get that clean document and that clean prescription, which is an ongoing journey, as you know, because you need to get renewed prescriptions. How do you build that relationship with the patient, keep them engaged, and manage them efficiently so that you're improving patient outcomes, you're improving revenues, because the better that patients convert through intake and scheduling and therapy adherence and resupply means more revenues for the businesses. But you want to do it at lower cost because you're constantly getting pressure down on the reimbursements. And so that's really where we're taking a different approach by focusing on the patient and managing that entire patient life cycle, but through a very intuitive, natural experience for these patients, using conversational AI, machine learning to detect all these signals of when's the right time to reach out to the patient through the right modality in a way that's empathetic, which is really interesting. You know, it's like, how can you make AI interacting with the patients empathetic? And then how can you also make it reasonable so that it's escalating patients to humans when they need it?
So what do you think really needs to change so that technology providers, or just providers in general, service providers to HMEs, can stop over promising and actually start really delivering? Like what do you think is the sweet spot there?
Yeah, I mean, it's so interesting because like as a company, you know, all this technology is new, there's so many startups, like you want to show that there's a vision and a future to get the DMEs excited that you're going to be a partner for the long term, because there's so many problems that these solutions can solve. We don't want to overpromise and then under-deliver, right? That is like the cardinal sin of technology. And we're constantly, you know, finding that balance because we're building new things. But we have to be very clear with our partners, like this is it's on the roadmap or it's in development. We can test it together, but it's not quite ready for your patients yet. But I think, you know, when DMEs are thinking about implementing technology solutions, one is like they should ask for references for sure, and you know, make sure that it's worked at a previous company, or if there's no references, because startups are, you know, they're new, do a pilot. And I always tell startups, like, get a paid pilot. You know, you want to make sure that there's actually money there for you, but do a pilot, test it on a small part of your workflow or small patient population, and then look for that ROI as quickly as possible. And for the startups, like the advice would be like, try and figure out what that ROI model would look like ahead of time. So like, what are the KPIs that you're shooting for? Align that with your partner, and then try and reach that KPI milestone as soon as possible. So for example, like our product, we have one way to think about the product is like advanced outbound agentic AI that's like doing a lot of the outbound outreach to the patient, retrying them. And there's a lot of precise engineering there, but it's more complex. It takes time to integrate. But another version of our product is just inbound phone support, where we take calls for DMEs and we manage multiple different skills that their teams do. And we absorb those calls and then we escalate what needs to be escalated to humans. That has a very quick implementation time and very quick ROI within a month. So we realized that's one of the best ways to like build relationships with the DMEs, is deploy that quickly, get a very quick ROI, and then expand from there. And so I think for DMEs, you know, see what part of these technology solutions you can implement, see a quick ROI, and then expand. Don't bite it all off. Don't commit too soon. And then also as a startup, you also don't want to necessarily commit too soon. And you don't want to overwhelm yourself with implementing a full solution when a part of the solution can prove value, and then you can expand from there, land and expand.
Well, you know, I love that mindset in advertising. I think David Ogilvy, he's like the father of modern advertising. He said the term aim small, miss small. And I really like that principle of you're not going to totally screw up your company or mess up any of your data or whatever you're trying to accomplish if you just start small, and pick. And we even have our whole CAST protocol, but we don't say let's implement the entire protocol tomorrow, Let's start with the most painful thing you're facing, and then slowly work into that, right? And
100%.
like, let's get that perfect and great, and then that's flowing, and like you can breathe now as a company, you can start innovating, you can start thinking, and then you go, okay, what else can we automate, or what else can we do? What new technology can we adopt, right? Yeah. And then you start onboarding that, right? Just a little at a time. It's not an all or nothing, you
right?
know?
Yeah, definitely. It's not an all or nothing, and then you always have to think about like what is the integration complexity,
right?
Because that's challenging for both sides. That takes resources from the DME.
That's right.
That takes resources from the startup too.
Yes.
So like, what can you do that's like requires minimal integration,
right,
to deliver ROI?
Well, with Valir, there's no integration, so it's very light. It's very light and easy. Yeah. That's our superpower, but
that's your superpower. That's your core competency.
That's right. So, as our last question, I just want to get in your brain space of like 5 years from now, what do you think HME is going to look like? Because really, the past 2 or 3 med trades have been super focused on AI. And so what do you think 5 years from now, what's HME going to look like? What are operators going to care about? And what do you think is actually going to have worked?
And I would actually combine, I would say the future is agentic AI driven value-based care. Okay. So I think it's actually marrying agentic AI, which are going to be entire operating systems for DMEs.
Right.
So DMEs are going to be run by agentic AI.
Okay.
And humans will just be overseeing it and managing it like a workforce. And it will be I think every DME will be slightly different in what that looks like. There will be certain players slot in, like the e-prescribe, the OCR fax intake solutions, the patient management solutions like ours, and then technology infrastructure layers like yours,
right?
You know, but people will have almost like an operating system that's customized to them, that's adaptive to their workflows, slightly different for each DME. And then what it's going to be tied to though is the patient outcome. And so that is, I think, the next generation of it, is once you have these smooth machines that are running really, really well, the goal at the end of the day is the patient outcomes.
Right.
And so once you're able to surface that at scale, because you have these automated systems that are consistent, that are empathetic, that still have human in the loop when the patients need it, then that's when you start really being able to go to payers and negotiating and being like, hey, we're not only able to like improve outcomes and get to 85, 90% adherence for our therapies, but we're also doing it at much lower cost per patient. And that's when you have like a completely new negotiating dynamic with where the money is coming from for these providers. So I think that's the future, is this industry will be like, as most industries, will be run in a substantial part, not 100%. You still need humans in healthcare, which is one of the beautiful things about healthcare. But in a substantial part will be run by, I believe, agentic AI systems, automated systems.